Well, welcome everyone to your community partner brought to you by Lehigh Valley Hospital Schuylkill. A lot of great things happening, and wait till you hear this show. There's interesting things, and I keep telling everyone that as we do these shows, they get better and better and better. Now, my good friend Bill Reppy, who is the president of Lehigh Valley Hospital here at Schuylkill, it's amazing to me how you do all the things you do. I mean, with the great doctors you have and the health care that they provide is just amazing. Give us a general update of what we'll be talking about today.
Okay, well, let's start with what's happened maybe since the last time we were here, Sam. So we just recently got certified as a level 4 trauma center here at Schuylkill. So that makes our ER now certified as a chest pain center, a stroke center, and a trauma center. So really proud of that work, and that's voluntarily done. So we ask them to come in and survey us and tell us, you know, how we could make sure that we're treating our community in a great way and high quality. And so very proud of our team to be a trauma center.
How do you achieve that the level 4?
Well, the Trauma Society of Pennsylvania actually comes in and surveys you, and so they you can pick the level that you want to be. Each level, it requires different resources, and we start with level 4, which is the basic level, and we are prepared and likely will go to level 3 in the next year or so. Some of the people we're going to talk to today as surgeons are a critical part of being a trauma center and their availability. So really excited about that work. You know, I know you did a show at our cancer center that we opened in the region, just phenomenal. But today, Sam, you're going to meet some new surgeons that have joined us here at Lehigh Valley Hospital Schuylkill. 2 well-trained general surgeons who work on our robot, so they're robotically trained, and really happy to have an oncological surgeon who specializes for us here in breast surgery. He's fellowship trained in oncological surgery. He is the only fellowship trained breast surgeon in Schuylkill County now. So our surgical team has just been enhanced by the 3 of them coming on board. I think the last time you were here, we talked about Dr. Guerrero, who joined us, the vascular surgeon.
Yes.
And then, of course, Dr. Dan Bobrowski, who's been with us some time, is part of our surgical team as well. So we've really been able to raise the bar for surgical services and local care for our community here.
You know, it's doing that interview with the cancer resource, it was just phenomenal, because when you look at what we have here in northeastern Pennsylvania, Bill, in terms of the doctors, you know, everything that's involved, it's just amazing, isn't it?
It is. You know, the investment that Lehigh Valley Health Network has done across our entire network, but certainly in our Northwest region here, you know, we've been blessed. We've been blessed. I'm sure our doctor's going to talk about our robot. We have the latest state-of-the-art robot here, the Da Vinci robot. You know, for a community hospital to have that type of technology, it's pretty impressive. It's pretty impressive. And then the Cancer Center, of course, was, you know, a multi-million-dollar investment in cancer care for this region. Yeah. So we're very excited about being able to deliver care close to home. It's one of our passions at Lehigh Valley Health Network to make sure that we can care for people as close to home as possible, as long as we can do it safely.
Yes, and you know, we talked about the responses that you get from the patients when they leave here, and they fill out their applications and they let you know what's that, you know. And I think, you know, when I was talking to you and Terry, you gain a lot from that, you know, and I guess that gives you direction as to, okay, we need more surgeons here, or we need this, or we need that. Am I correct in saying that?
Absolutely, absolutely. We actually do, I'm sure you remember, the CHINA, the Community Health Needs Assessment, and that helps direct where we're lacking in services. So our last CHINA that we did, primary care was identified as a need in the region, and so after that, not just because of that, but after that, we started our residency program, and you've interviewed our residents. Yes. We just got 4 new residents in July, so we now have 8 full-time residents here in primary care and family medicine. And you know, I'm happy to report that at least 2 of the 8 that we have already committed and signed a contract to stay in this region. And that was part of our mission. So yes, our community gives us feedback, tells us what they'd like us to provide, and if we can do it safely, we will.
In terms of recruitment, okay, and it amazes me, how many doctors have Lehigh Valley brought on, you said?
So in the first quarter of our fiscal year, so that's July through September, we brought on 77 new doctors across our health network, and you're going to meet 3 of them here today. So we're blessed. We also hired an internal medicine doctor for Origsburg, so that doctor will be joining us in December, and I'm sure we'll have an opportunity to introduce him to you as well once he gets on board here.
And they all bring a wealth of knowledge, okay, and we'll find that out later on. What do you see in terms of healthcare here in our area, where we've been able to limit people saying, well, we have to go out of town, okay? Those were the old days, okay?
Absolutely.
Now what we have is amazing, okay? And how do you encourage people, staying in this area?
It's work, because people have, in their mindset still, but it's really bringing in doctors like you're going to talk to today and introduce them to the community, and they see the talent and the assets that we're bringing here. And once they get introduced to these doctors, I'm confident they're going to want to stay here. We're blessed. They're very talented, very well-trained physicians, and I think that we will change that STEM. And we have. We've made a difference. But part of that is having the resources available in the community. So if we didn't have the oncological surgeon, of course they're going to go somewhere else for that.
Sure.
Now we're lucky enough to have Luke in our region here, and he's going to do great work and help our community locally. We're an aged community. We live in an older population, so travel is a challenge. And so we're committed to do everything we can to deliver care close to home.
Yeah. And when you talked about, different demographics, all right, and looking at our demographics in northeastern Pennsylvania, as Brian mentioned on the show, Brian Nestor, my friends, he's the CEO, president of Lehigh Valley Health Network, talked about the need that we found in the Hazleton area with the cancer, okay, which is unfortunate. But I always say, there you have good news and bad news. The bad news is when you're told you have cancer, God forbid. But the good news is what we have available to you to sustain your life.
Absolutely.
Am I correct in saying that?
Absolutely. And Schuylkill and Luzerne County are very similar. We're like 4th or 5th in the state for the incidence of cancer. And so having that resource close to home, I think, is critically important. Certainly before we had that cancer center for radiation therapy, people had to drive, over an hour to get radiation therapy with Lehigh Valley Health Network. Now it's within about 30 minutes at worst case scenario, and certainly for our Hazleton community, it's in their backyard.
How long have you been here, Bill?
I've been at Schuylkill for 7 years. With Lehigh Valley Network for 9 years.
So go back 7 years and see what has happened in 7 years. It's like, woo, it's amazing, isn't it?
It is. Again, the investment that the network has committed to this community is phenomenal. The number of physicians we've been able to bring in and the partnership with the local physicians that we've been able to do, it's been phenomenal. I'm thrilled to be here. I'm thrilled that Lehigh Valley Health Network is treating our community.
And it shows. It shows here in the hospital, So I'm looking forward to that. Now, the doctors I'm interviewing, who are they now?
Dr. Lal, Tanmay Lal, Dr. Karolin Ginting, and Dr. Luke Rodriguez.
Okay, my friends, this is your community partner, brought to you by Lehigh Valley Hospital Schuylkill. We'll be back right after this. Welcome back to your community partner, my friends. We're here at Lehigh Valley Hospital Schuylkill. They keep raising the bar. It's just an organization that brings so much great health care to the area. Now joining me are 2 newcomers, not to the profession, but to Lehigh Valley Health Network. We have Dr. Karolin Ginting and we have Tanmay Lal. Am I saying that correctly?
Yes.
Okay. First of all, congratulations to the both of you for coming to a great organization. Okay.
Thank you.
Okay. Tell me a little bit. This is Dr. Ginting. Tell me a little bit about yourself, Doctor.
Yeah, so I'm new to the area. I did most of my training in Ohio area. I went to medical school in Wright State in Dayton and residency in Cincinnati. Now I'm excited to move here, relocate here, and start serving the community here.
Okay, a couple questions. Number one, when you look at you, you look like you're 18 years old.
Well, thank you.
And you have one child and one on the way, right? Okay. And I said if it's a boy, name it Sam, but we'll talk about that. So tell me, what do you bring to the Lehigh Valley Health Network?
Yeah, so most of my training, I train in a general surgery, so I'm very comfortable taking care of all the basic general surgery need, bread and butter. I also have special interest in minimally invasive surgery. I train in robotic surgery and also laparoscopic surgery. So small incision, hopefully, make the healing process a little bit quicker and less painful. So I hope to bring those to the community here.
So why did you decide to become a doctor?
Oh, that's, yeah. I think, I always like science. I like medicine, and I like the idea of bringing that to the community to help people kind of gain interest during college and do a lot of volunteering, and decided to go to medical school.
Yeah. And why surgeon?
I really like working with my hands. I like the arrays of treatments and procedures I can do to alleviate pains and solve problems. So I really enjoy that during my training in medical school, and I decided to be a surgeon.
Well, we're showing the robotic. What is the difference between actually doing the surgery and using a robotic?
A few things. I think for the patient side, we'll be able to do more complex procedures with much smaller incision than the traditional kind of, you zip open a patient's. Now you can do it in 4 or 5 small incisions. For me, it's better kind of visualization, better accuracy and precision. So. I really like it.
You like it. So what general surgeries do you do with the robotic?
I do anything from gallbladder surgery, hernia repairs, and colon resection. So there's a lot of applications to the platform.
You got to be very steady with your hands, I think, right?
Yes, but yeah, definitely.
Because it's very delicate.
Yes, but that's another thing that's good with the robotic surgery. I think that the robots kind of help with adding precision. So yeah.
Yeah, I find it interesting, but you really have to have the experience and the talent to do that, But
Yeah.
you think robotics better than actually doing the surgery? Or do you need to decide whether you?
Yeah, it will be like patient specific. That's something that we'll talk when I see patients.
Mm-hmm.
I think each, techniques have their own, advantage and risk associated with it. So when I see patients, we'll discuss which method would be the best for the patient, and hopefully with the additional, training that I have, I can provide an array of different treatment platforms.
Dr. Tanmay, right? Lal.
Yes, sir.
Okay, welcome to Lehigh Valley Health Network. It's a great organization. Why did you decide to come here?
Well, I was working in Ohio prior to coming here, and I was looking for another position, and one of the positions that was open at that time was this one. So once I came here for an interview, I really liked the community, I liked the healthcare organization. I also have had a lot of experience working in a hospital similar to this one, so I felt very comfortable choosing this place just because I felt welcome here. I felt that this was a good organization that could support me and my patients.
That's great. And why did your background?
So I did my medical school in India, and then I came here, did my residency in Jefferson in Philadelphia. And then this was a long time ago, and then I went to Ohio, and I was in practice for almost 20 years before I decided to come here.
Like any doctor or any businessman, you bring some things to the table. What do you think you bring to the table in your profession?
So what is unique to me is the fact that I have had a lot of experience working in a smaller hospital. So I know the kind of patients that tend to come to hospitals like these, smaller, underserved rural communities. And a lot of them are very sick. A lot of them are older, and they have unique health challenges. And I feel that, with this hospital affiliated with the mothership at Allentown, provides the perfect background for us to give that kind of care for them, so that we can take care of patients here that we can, and if we cannot, then we find somebody who can in Allentown. So I think that is the best of both worlds, both for the patients and for myself.
I say that all the time. I mean, that's you have the marriage between here, and then if you need something, so you're actually seeing a lot of doctors when you have one patient. to be able to confer with them, right?
Exactly.
That's one of the things that I think where people think they have to go out of town was absolutely no reason for that. Yeah. What do you specialize in? Anything?
So my initial specialization was in transplant surgery, but I don't do that anymore.
Oh.
So I do all gamuts of general surgery, and like Dr. Ginting, I also do robotics. So hopefully the two of us can bring that to the patient population here and provide that kind of care.
What transplants were you doing?
I specialize in liver, kidney, and pancreas transplants.
Wow, that's amazing. And you moved it in the other direction, yeah. But and what do you think you bring to the table here with the Lehigh Valley Hospital?
Hopefully, I would bring my expertise in general surgery and minimally invasive surgery, and we're both also do screening colonoscopies and EGD as well. I know there's kind of like a big need in this community, so we're ready to serve.
I find it interesting because, there's always new technology coming out. There's always advances in medical, and so you take, you've learned differently than other people who were 15 years ago, 10 years ago. What are some of the things that, new in technology or new in science in your field?
So, robotics is relatively new. It came to the fore in 2011, 2012, something like that. And over a period of many years, it has grown exponentially, especially in our field in general surgery. It used to be very commonly used in OBGYN and urology.
Yeah.
And now it's being used a lot by general surgery. And the advances in robotic technology and artificial intelligence, computer science, all that has been used for the betterment of healthcare and betterment of taking care of really complex patients. And I think it's only going to get better because we have so much new technology in the works, so much new instrumentation, so many new applications for the robot, and who knows, artificial intelligence is here to stay as well. So we'll see a lot of that as well.
Is the healing process faster if you have a robotic surgery?
In general, yes. I think partly because we can do the surgery with better precision, less blood loss, and smaller incision. So I think that's easier for the patient to manage their post-operative pain. But again, it's kind of like one additional technology that we can offer to the patients. But we can also provide other surgical technique like laparoscopic or even open surgery as well. So we're able to hopefully personalize that with the patients that in front of us.
Well, I wish you the very best. I wish you the very best. You could come to a finer organization than Lehigh Valley Hospital. They're just on top of things. So good luck with the new one coming in.
Well, thank you.
Don't forget, Sammy is a good name, or
Yes.
Sam. Okay. Good luck to you. Okay?
Thank you, sir.
We're going to take a quick break. We'll be back right after this. Welcome back to your community partner, my friends, brought to you by Lehigh Valley Hospital Schuylkill, and that's where we are today. Now, we interviewed Dr. Ginting and Dr. Lal. I want you to know that both of them are in the Institute for Surgical Excellence. Now, my interviewee is Dr. Luke Rodriguez. Welcome aboard.
Thank you. Happy to be here. It's a pleasure being involved and seeing all this new progress that's being made.
I see a lot of young people, a lot of young doctors. I'm sure you bring a lot of wealth of knowledge to the to your field.
Yeah, wealth of knowledge, and I think the desire to do more, to kind of be that initial person starting out at a young age to really develop and get tied into the community and just start developing things early on.
A little bit about yourself, your background.
Yeah, actually kind of local, depending how you look at it. I was raised in Easton, Pennsylvania, so about maybe an hour and a half, give or take, depending where you leave from this area. On the weekends, we would actually come to this area quite frequently with my parents, and also the Poconos. So this is kind of like my backyard, if you want to put it that way.
And why go into surgery?
So surgery for me was it was a personal challenge. I remember going in undergrad. I actually started out with physical education, and after a semester or so, I just didn't feel it was that same drive I was expecting. So I decided to switch to medicine. And when I went into medicine, it was more of a challenge, and it kind of made me really challenge myself and see what are my capabilities. And during the process of applying and then getting experiences during the whole process of med school, I graduated towards surgery. Reason being is my upbringings. I grew up in the countryside. We did a lot of things hands-on, things carpentry in the house, working on cars by ourselves. So a lot of stuff was hands-on work. And surgery was something that drew me towards that because it was something I could fix a problem myself with my hands. And it was a gratification because I knew I was doing something right there at that moment that would change them for the better overall.
And why this specific area that you went into, oncology?
So oncology it's one of the things that unfortunate people have. And no one ever wants to go about their day, realize there's something, maybe it's abnormal that they notice, or they just go for screenings and then, oh, there's something we can pick up there. And then you get to the next step. So there's a stress that just happened in that moment because it's now out of the norm of your already stressful life. And then getting to the point of getting these biopsies and then it's coming back, the worst possible, it's a cancer. So for me, oncology, there's a lot of stresses these patients go through, and me and my personality, I think the way I try to approach each patient is really have them understand that I'm a person, I want to be there and help them through this process. I just don't want to just take care of them, but I also want to make sure that they're getting anything that they need addressed at that time. The stresses of life, the stress of the diagnosis, really understand what's going on and not just treating them as a patient, but really treating the patient as they should be treated as a human being, because we are all human beings. We all go through stresses in life, and having someone there to give you that hand and pull you up and take you along the journey and then get to the point where you can finally release and let go and continue your life is very gratifying.
And we talk about latest in technology. We certainly encourage mammograms, correct? And but if someone does have a lump or it's cancerous, at least you have the latest technology to help that person. Am I correct in saying that?
You're very correct in saying that. I think that's one of the great things that we have at the Topper Cancer Institute. We have the beauty of having an umbrella of so many specialties and so many different providers underneath it that once the patient comes in, they're being seen by multiple different specialties if needed. They don't have to be going out to a different health institute. They don't have to be going out to a different state. And one of the other beauties of having this cancer institute is we have affiliations with one of the largest cancer centers in the world, yes, which is Memorial Sloan Kettering. And the fact that we have this alliance allows patients who otherwise may have been pushed off saying, there's nothing I can do for you. We are happy to take them and see if there's a clinical trial that's currently being undergone that they could be a candidate for and actually receive a treatment that, as of right now, we don't know, but actually could be very beneficial for the patient and extend their life.
And you're pretty active in the community, I understand.
Yeah, I like to. I mean, I think, we are, me as a provider, getting out to know the people I'm going to be treating, I have to get out to being part of the community. So just going out, doing little things here and there and volunteering and just really getting to know who I'm really treating is probably important because these are people I might be crossing someday in the supermarket. Somebody, maybe if my tire blows up on the side of the road, they'll come by and help me because I remember you from that game. And just showing that, I'm there as a human as they come to me as a human, and I want to make sure we're, as humans, can coexist.
Look, it's exciting for me to see all the young physicians coming on, and well as people like Tanmay, who have experience coming into Lehigh Valley Hospital. I just think it's great. I wish you the best.
Thank you. It's a pleasure. Pleasure's all mine.
Yeah, good luck to you. Okay.
Thank you.
My friends, community partners, brought to you by the Schuylkill, Lehigh Valley Hospital Schuylkill. They keep raising the bar all the time. And once again, I want to thank you for making the Sam Lassana Show the #1 talk show in northeastern Pennsylvania. Phone numbers on the screen, how you can contact these doctors. They're absolutely fantastic. We'll see you next time.